when you have a labral tear with a shoulder injury in your dominant throwing arm in the NFL, it doesn't affect your draft pick or your performance in the NFL once you're recovered. Amazing. Trevor, you're going to be fine. Oh, wait a minute. It's your non-dominant hand. So why are we talking about this? Why the heck does this matter? Well,
why did I make this video?
Why did I make this video? So now that Super Bowl is over, let's think about what's going to happen in the future Super Bowl. So let's look at an upcoming kid, Trevor Lawrence. He's probably, well, from what I hear and read, he is going to be the #1 draft pick. Okay, so Trevor Lawrence from Clemson, about to have shoulder surgery. Wait, shoulder surgery and NFL? How does that affect the draft pick? How does that affect his career? Interesting you mentioned that. So there's actually data from the NFL. Now it's level 4 evidence, level 3, level 4 evidence. It's not a randomized clinical trial. It doesn't meet the criteria for level 1 evidence or level 2 evidence because it wasn't followed. It was done retrospectively, so technically it could even be level 5, level 4, level 5, because you could get some of the reports are basically anecdotal opinions as well as a retrospective review, so you don't have all the data. However, in all of that, what it did show is that when you have a labral tear with a shoulder injury in your dominant throwing arm in the NFL, it doesn't affect your draft pick or your performance in the NFL once you're recovered. Amazing. Well, he's having shoulder surgery, so it is important to know. But non-dominant shoulder, and even if it were his dominant, it's based on the data from the NFL and published reports, you can pull it up. And what it basically showed is that it doesn't affect your actual performance, play, or draft choice. Now, however, one thing that's important is if it's your throwing arm and there's associated bone loss with a posterior labral tear, then it can shift a little bit, okay? It could affect your draft pick, but it overall doesn't affect long-term your performance unless you had a lot of bone loss, okay? So bone loss in the shoulders, if say part of the socket, which is the glenoid, you take a chunk of bone off, which can happen. It can happen in an anterior shoulder dislocation where you get a fracture where part of the bone comes off, called a bony Bankart injury. You can have that with the posterior where you take part of the bone off and then you have a posterior glenoid bone loss, or you get erosion of the glenoid if it's a chronic injury. In those situations, there is some evidence, again, level 4, level 5 data, that suggests that it may affect your actual draft pick and performance, but in the long run, the performance is still well for your draft level, okay? So basically, if we were to look at how is he going to be able to perform for spring training? Honestly, the answer is going to be more than likely yes. He's going to have the surgery if he hasn't had it already by the time this video comes out. He's going to be in rehab, recovering, get his range of motion back, and depending on the size of the tear, which we actually don't have all the data on, sounds like it's just a labrum, more than likely. If it's anterior labrum, posterior labrum, non-dominant, he should be able to throw well. Now, he'll really start warming up and kicking into high gear 6 months to 12 months after his surgery, but if we look at, say, 3 months after the surgery and he's throwing with his arm and practicing, I think he should be off to a good start. Now, the healing is variable. Nothing's 100%. Most of these are over 90, over 95%. And with these young athletes, they're going to heal really well. And it all comes down to, one, getting the labrum in the right spot with a qualified surgeon, which they have. And second, they're going to he's a young player who's going to heal well, and he's going to go through rehab. which is the third. So all in all, he will do well, more than likely, barring any complications or other risks and benefits of surgery, which any surgeon would obviously go through with you and talk to you about and scare the heck out of you, because surgery's serious. And that's why it's important that we never minimize that, hey, it's still an operation, but it's arthroscopic shoulder surgery, which is done so commonly, and this type of injury is so commonly repaired with the quality of materials and techniques and implants and instrumentation and techniques that we have, that he should do well.
And it's his non-growing hand, so he doesn't even need that arm.
He doesn't need the arm. You can chop it off. He'll be fine.
The first one-arm quarterback.
Oh, well, we had a one-armed drummer.
That's true.